Hey, John. All right. Good morning, everybody. Lovely to be back together on a Tuesday. John, good to see you. Thank you for being with us.
Thank you. My pleasure. Thanks for having me.
Roy, I missed not getting to see your study, but you're advertising Berkeley very well there. Campanile in the background. My wife would be very happy to see that.
You know, change is good.
I suppose. I'm one of the few members of the clergy that hasn't yet done something where they made it look like they were sitting in the balcony of the sanctuary, which is not a bad look.
Well, that's actually one of my goals. I'm hoping to get hold of a photo of the interior because it's so beautiful.
If you send me an email, I will. That will remind me. I might be able to help you with that.
Oh, thank you.
All right. Well, thanks everybody again for taking a little bit of time out of your day to join us for hope. Since almost everybody here is been with us at least the last couple of weeks, I'll take that as a compliment that you found this interesting and not tedious. I know I certainly have. And in thinking about our conversation today, I thought about the fact that at the moment, anyway, so much of what we're doing at the temple, so much of what we're doing at the Karsh Center in terms of, taking care of people and responding in the midst of this crisis really centers around food and also providing diapers. But, we've seen about a four to five fold increase in our demand for food through our Sunday morning food pantries. Our mobile food pantry programs are on hold, but we have many of our collaborating organizations reaching out to us daily, asking us if we can help supply food to them so that they can then in turn feed their clients and feed folks who need it so desperately. And in some ways, I think that in the midst of this crisis, the fact that we've really doubled down on food is appropriate because that's in a way how this all began, as some of you know. Back in 1988, almost 32 years ago, we opened up a food pantry at what is now the Glazer campus in response to a growing hunger concern that we were observing in the community. Our brothers and sisters at churches in the neighborhood were feeding folks most days of the week, but not on Sundays. And we thought, well, we can do Sundays because that's something that it's not a faith day for us and we can do something to help. That was now almost 32 years ago. And now almost 12 years ago in 2008, as a means and a way to celebrate what was then the 20th anniversary of that food pantry program, we started to think, well, maybe we should be trying to feed more people. And we had a temple member at the time who lived on the West Side and knew about this remarkable social service organization then called OPCC, Ocean Park Community Center, which was the oldest social service provider on the West Side. And one small piece of the amazing work that they do is feeding people. And they also we're looking for somebody on Sunday mornings to take responsibility to feed homeless in Santa Monica who so desperately needed it. And we thought, well, what better way to celebrate the 20th anniversary of the food pantry than by expanding what we're doing across town. And we began this collaboration with what's now the People Concern. And we've been there Sunday mornings feeding, about 250 folks, rain or shine. And it's grown into a really special relationship institutionally between the temple and now the Karsh Center and the People Concern, and also a special relationship I'll just share personally with my good friend John Maceri, who they are lucky enough to have as their CEO. I said to John, I think when we first met, about 10 years ago now, something like that, that in my experience in the nonprofit world, many of the folks that run organizations do so because they wouldn't last very long running a for-profit organization. And that whenever I meet folks who are incredibly talented at what they do and use those talents in the nonprofit world to try to make the world a better place, those are the kind of folks that I want to spend time with. Those are the kind of folks that I'm inspired by. And those are the kind of folks that, to put it in business terms, I want to be in business with. So we've really, really enjoyed this collaboration for, almost 12 years now. And I've certainly enjoyed my friendship with John, and I'm thrilled to welcome him today to talk to us a little bit about the people concerned and sort of how they've evolved into that organization, and what they're seeing in dealing with folks who, as many of us probably know and imagine, life is already challenging enough for, and in the midst of crises such as this, those are often the folks who bear the brunt of the challenge and the brunt of the hardship in the midst of this. So John, welcome. And maybe you can start by just sharing with us a little bit about, who and what is the people concern, today as it's evolved.
Sure, I'm happy to do that. First of all, Bo, it's really nice to see you, and thank you all for joining. I can't see all of you on the screen, but I appreciate you taking the time to zoom in and to listen. And the personal and professional feelings are mutual, as you know. We've been very blessed and fortunate at the Access Center to have Wilshire Boulevard Temple be such a strong partner and collaborator over all these years. So I think it really is appropriate that we're talking about food, because that's one of the significant increases that we have seen at our Access Center, and actually even in our permanent supportive housing as well. So I'm sure many of you are probably familiar with the People Concern. The People Concern was actually formed 4 years ago in the merger between what was then the Ocean Park Community Center and Lamp Community. What a lot of people don't know, Lamp Community is based in Skid Row, right in the heart of Skid Row. The woman who started Lamp was a woman named Molly Lowry, who was actually one of my predecessors at OPCC. She was the director there for about 8 years and then went downtown to start Lamp Community. And it was always her hope that someday the organizations would be combined. And so that happened. She passed away, it'll be 4 years ago, I believe, this August. And so she was able to see that happen before she passed. So today, the People Concern is, we do several core services. We begin with street outreach and engagement. So we have multidisciplinary teams that are on the street every day, that are going out to the parks, the beaches, freeway overpasses, anywhere where people experiencing homelessness are in the public space, and working to engage them, first to build a relationship. And then of course, the ultimate goal is to connect them to housing and ongoing services, because our ultimate goal is to move people indoors. We operate an Access Center, which Wilshire Boulevard Temple has been supporting with the Sunday lunch program for many years. It is a drop-in center that sees about 250 people a day and meets their basic needs for hygiene. So we operate showers, toilets, laundry facilities, food, clothing, and then we have a primary care clinic that is operated there by our partners at Venice Family Clinic, so people can access primary medical care. And then we provide case management, housing navigation, and connection to mental health services, substance abuse treatment, and housing. We operate interim housing, so we have about 350 interim housing beds throughout Los Angeles County. And that provides a place for people to live, really a bridge between the streets and permanent supportive housing. And then we provide the last step in the housing equation is our permanent supportive housing. And we're currently supporting about 2,000 people throughout Los Angeles County. So all the way from the Antelope Valley down to Long Beach. And these are people who are living in their own units. They're mostly apartments. They have leases, and they're paying rent, and they're living independently. And so our role there is to help them remain housed. And then the kind of wraparound services around all of this are mental health services, primary care, substance abuse treatment, and general health and wellness, which is kind of a broad catchment for helping people develop the skills they need to live independently and to thrive, because we tend to work with people who are pretty high acuity in terms of either their mental illness or their physical health challenges, but we want them to be able to live independently and be as independent as possible. So that's a very broad overview of kind of who we are and what we do. So I always kind of describe it as, we begin with building relationships with people on the streets who have often been outdoors for a very long time and who've been very disconnected, often from their family, their friends, any kind of support network. And we walk with them in their journey, of recovery, whatever that looks like for them, with the ultimate goal of getting them back into permanent housing.
Thank you, John. That's a question is, so has obviously the geography of the services being provided has changed over the last 4 years with the merger. Have the service offerings changed?
Not substantially.
New service areas, or?
Well, here's what I would say. In the merger, there were components that then OPCC had that LAMP didn't have, and vice versa. So I would say in terms of the we were both providing interim housing, we were both providing permanent supportive housing, we were both providing mental health services. LAMP has had a very robust and well-developed arts program that is not just inwardly focused, but actually is a community arts program. And we have an art studio in the heart of Skid Row. That was new for OPCC. We had an arts program that was targeted towards women who were residents in our interim housing program. So that was a change for us. LAMP also had a money management program. So people who were receiving Social Security benefits or general relief payments, both housed and unhoused individuals, to help them manage their money, to make sure that their rent get paid, their bills get paid. We did not have that equivalent. We had a savings program, but it was and the money management was much, much smaller. So that was an extension. And on the west side, we operated in an access center. We had primary care, which had not been part of LAMP's portfolio. So pretty expansive of role in terms of providing primary care to residents of LAMP community. So I think those were the primary shifts. In terms of the people we serve, we have not seen a significant shift both before the merger or post-merger or even today, because we have always worked with pretty high acuity individuals. So these are people that are struggling with serious and persistent untreated mental illness, people who have chronic health conditions that have not been managed well because of their lack of access to primary care. We have seen an increasing number of seniors and people with mobility challenges. I would say as the general population is aging, our population is aging as well. So those are some shifts, but in terms of, we're not seeing a lot of families coming to us now or young people, because our wheelhouse has really historically been primarily single adults. That doesn't mean that those adults may not have children, but they generally don't have children living with them or accompanying them. And they tend to be fairly sick. And I don't mean that to pathologize people. I mean literally physically sick.
Yeah, I can imagine. Well, so that's kind of a segue, I suppose, to this, crazy reality that we all find ourselves in the midst of this pandemic and this crisis and quarantine and social distancing and isolation and all of that. And obviously, People Concerned provides essential services. It looks like you're sitting in your office right now.
I am, yes.
How has this crisis impacted your services to clients?
Well, it's obviously we are an essential service provider. So we had to make the decision early on how we were going to continue to provide services with a reduced workforce, because we have, when LAUSD shut down, we have many staff who have children who had to stay home and take care of their kids. Some of those people could work remotely, some couldn't. And then we had to determine, all the services that we provide, what are going to be the essential services that we need to keep operating. So we made the decision early on that We consider our essential services, the street outreach and engagement is critically important, especially, and I'll talk a little bit about my experience, because in addition to being in my office, I've also been working shifts at one of our interim housing facilities and also at the Access Center. So I've had an interesting kind of compare and contrast for what it's like for our clients. But we felt that street outreach and engagement, especially as this was before we knew that Project Room Key, which was the county's initiative to bring more people inside, was going to be in effect, that was a critical lifeline to people who are on the streets and were going to need some support. Our Access Center, obviously, because of the access to hygiene, showers, toilets, laundry facilities, food, and the primary care clinic, continues to operate. We had to scale back our case management, our housing navigation services, because frankly, the housing authorities aren't really doing unit inspections. Processing applications is really challenging. So we had to shift away from that and focus more on sort of what I would call frontline emergency services. Our interim housing programs, obviously, we're housing 350 people across the county. There was no way we could shut down those facilities, so we had to keep those operating. And then our public toilets, showers, and laundromat in Skid Row for a long time, Lamp Community, until about really 2.5 years ago, operated the only public toilets, showers, and laundromat that were open in Skid Row. The refresh spots have helped support that, but we felt it was critically important to keep those facilities open so people had access. And then finally, the money management program, because people, as a representative payees, we wanted to make sure that they had access to their money, and that for individuals who were housed, that their rent and their bills were being paid and they had money to buy food, and for people who were unhoused, that they had access to their money to be able to help them, survive while they were still outdoors. So for us, I would say that, the biggest shifts have been, we're in a people-centered and a people-oriented business. So I think it's been really challenging for even our staff who are working on the front lines, the whole idea of social distancing and having to kind of limit contact has been a significant shift especially for our staff, I would say at the Access Center, our outreach teams who are still coming in contact with people, but obviously for the protection of the people we're serving and for the protection of our staff, there are limits in terms of what we can do. So that's been a pretty significant shift. I would say that from my own experience, as I said, I'm working regularly. I've been at one of our interim housing sites in Santa Monica, and I've also been at the Access Center. I would say that the folks in interim housing, while there's a high level of anxiety that I think we all feel about, when is this going to be over? When are the stay-at-home orders going to be lifted? When is, life going to get back to normal, whatever that looks like? They are very grateful to be indoors. They feel safe. They are very concerned about their friends that are still on the street and that are not indoors. As compared to our clients at the Access Center, there's a general sense of feeling abandoned. Even as they're coming in for services, there's a high level of frustration because essentially public access to anything has been cut off. So, things that we take for granted, many people experiencing homelessness go to the libraries regularly to have access to the internet or a computer, or to just get out of the elements or to charge their cell phone. That's not available to them. Starbucks is another place that a lot of people, especially in the mornings, will go to, again, charge their cell phones. So the world has become very small and very contained. So the frustration that we all feel, when we're isolating at home, and we may be by ourselves or with our family members, people living on the streets don't have, their social networks are very different than ours. So I've heard and seen and witnessed really a high level of frustration and kind of a sense of hopelessness, for a lot of people. And that makes me very sad. On the one hand, obviously, I feel, very empathetic for people who are already struggling and suffering. On the other hand, it also makes me realize why the kinds of services that we're providing are so critically important now, is because you think, a sack lunch isn't a big deal, but I'll tell you, when you're hungry and that may be the only thing you're eating that day, it's a huge deal. Or a clean pair of socks, or a chance to, take a shower. I had the first Wednesday that I was at our Access Center was about the second week of into the stay-at-home order, and we had an older gentleman, and I just, this sticks with me because it's so heartbreaking. He was waiting in line for the shower program, and because of social distancing, we've had to keep people apart, and of course, it takes longer because we can't have as many people in the shower, so everything, takes longer. Everything is hard. And this gentleman just had a complete meltdown on the sidewalk, and I went out to talk to him, and he just said, he said, it's hot, I'm tired, I'm dirty, my cell phone is dead. I just feel like, there's no hope. And, that really stuck with me because I think he was expressing what many people that we're serving feel. So, that's just, one person and one point in time, but I think it lifts up the importance of being there for people who are already, marginalized and don't have a lot of options and now have even fewer.
Absolutely. You mentioned Project Room Key. Can you share with us, for those who don't know, a little bit more about that?
Sure. Well, you may have seen the Times has started to do a little bit of coverage about this. So Project Room Key is an effort by the County of Los Angeles. It's in collaboration with LAHSA, but the County Homeless Initiative Office is really driving this. And the goal is to master lease, for the county to master lease up to 15,000 hotel and motel rooms across the County of Los Angeles to move people off the streets. And it's particularly targeting, high acuity, high vulnerability, which frankly is most people who've been outside. So it's people who are 65 years or older, who have underlying health conditions, who really need to be inside. And let me say, I think we all agree everybody needs to be inside. So it's a little bit of a Sophie's choice in that sense. However, the effort has been successful. We're not at 15,000 units yet, but several thousand motels and hotel rooms have been leased. And then service providers such as the People Concerned and our colleagues in the field are taking responsibility for staffing these hotels. So they're essentially it's providing isolation units for people to be indoors. And that effort started about 3 weeks ago. I think the first hotel rooms came online about 3 weeks ago, and every week there are more that are being added. So the city is out actively master leasing these hotels. And when you think about it, it's really a way to repurpose existing assets because people are not traveling. The hotels largely are vacant. And there are these properties that can be used to move people indoors. So that's what Project Room Key is about.
So it makes me think of two things. First, you mentioned earlier that for many folks who are experiencing homelessness, their social networks look very different than ours, but they do have them, right? So, So what does it mean to take someone who does have some community on the street and to completely isolate them, by themselves in a hotel room? And I wonder.
Yeah, that's a great question.
Other challenges.
It's part of I think it's part of the struggle operationally as well. What we've tried to do, and this has been an effort in terms of identifying, who will go into the hotel rooms. It's a combination of the outreach teams that are working in the areas, the street outreach teams that are working in the areas where the hotels are located, working with LAHSA through the what's called HMIS, the Homeless Management Information System, which essentially is a centralized tracking database for people who are connected already to services, and we know some history about them in terms of their acuity and their vulnerabilities. And to your point, if people are living together in a social situation on the streets where it makes sense for several of those folks or all of those people to move indoors, then then we can do that. What's hard, frankly, is there aren't adequate hotel rooms. Even at 15,000, we would be covering about a fourth of what we need. So these rooms have to be targeted to people, as I said, who are highly vulnerable and are kind of the high risk categories. And anytime, I mean, even without COVID, we experience this in our own work when our street outreach teams engage with someone who wants to move indoors into one of our interim housing facilities, or wants to go into a sober living environment. It just removes themselves, from the streets and their social network. One of the things that is a challenge for us is, how do you manage that? When one person wants to come in and the other people in their network don't or can't. It's not easy, to work through that.
Well, and also, right. So what happens, at some point, this will be behind us, and life may look very different and not look, the same way that it looked 8 weeks ago, but this will be behind us. People will go back to stay in hotels. So what happens when this is over?
Yeah.
And, everybody's got to check out of the Marriott?
Yeah. It's a great question. So we've actually, as providers, kind of raised this question, because right now these rooms are leased through the end of June, and we are not going to have 15,000, affordable or permanent supportive housing units for these individuals to move into. It's not like there's suddenly going to be all this new housing stock post-COVID. And so the reality is that some of those individuals, and there's already conversations going on now. There's a policy group at the county level, county and city level, working on what is the exit strategy? Because I think we as providers, it's a bit odd, because on the one hand, from a public health standpoint, it is absolutely the right thing to do to move people indoors, both for their safety and well-being, but also for the well-being of the community, to try and minimize community spread. So no one is arguing that it's a bad thing to move people indoors. I think the challenge on the back end is, what do you do, when you don't have an equivalent number of housing units to move people to? So I think what will happen is that it'll be a combination of things. There will be some individuals that'll be matched to permanent supportive housing units that are coming online through Measure H. There will be some individuals who will return to interim housing facilities that either they were in before they moved into the motel, or who in beds where there become vacancies, and there's an option for people. There's been some conversation that some of these hotels, motels may be purchased by either the county or the state and become permanent, or not permanent long-term, but for folks who are currently in them, able to stay longer. And that will not be, all the motel rooms that are being used. And I think we have to be honest and say there will be some folks that will return to the street because there aren't any options for them. I think the hope is, and I can just say this we are operating two currently, or in fact, our second one is just opening today. Our hope and our goal as a service provider is to use these next couple of months to really encourage folks to look at every housing option. We're going to have to use every tool in the toolbox. There will be people that'll be appropriate for shared housing. There'll be some people that need to be in assisted living, some people board and care as that's available. And everything I'm mentioning, of course, is limited. So it's not like we have a whole stockpile of housing options for people. We didn't have that before COVID. We're not going to have it afterwards. But I do think that kind of breaking the cycle of homelessness, even temporarily, gives us an opportunity to work with people and at least explore options that might be available to them, and in some cases will be available to them if they will take advantage of them.
I think just the idea, right, that this is such a fluid situation and such a fluid challenge, and we have to remain, I think, creative and adaptable in how we respond to it, right? Whether it's the county purchasing these hotels and turning them into a more of a long-term situation, or trying to get very creative, as you said, about where we can put people and what kinds of options actually exist.
Yeah.
Right? Because I mean, the question came from the sense of like, oh my goodness, this ends, and are we just taking 15,000 people and casting them back out on the street?
Yeah.
Which kind of just puts us back where we were instead of using this as an opportunity to move the needle.
Yeah, no, I think that's right. And, the conversations we've been having with the policymakers and that we're having, frankly, with the residents is that this is a time for us to think about what are the alternative housing solutions that are available and will be available to people. That one of the things that I have, and I've been, at this a long time, I'm almost 21 years at the agency. And one of the things that I've always, said both to our staff and to our clients is that, I think we have in some ways done folks a disservice in that we hold out having your own apartment or getting a voucher as the holy grail of housing, right? That's the ultimate thing that everybody wants. And yet there has never been enough vouchers. There have never been enough housing units. And the current cost and scalability of developing housing is very expensive, and it's not going to get any cheaper post-COVID as land prices are, not going down. The ability to get building permits and all of that is going to be, I think, even more challenging. So I think, and I'm not trying to be Pollyanna about this because we have a huge number of people experiencing homelessness before COVID. We're going to have, as many, probably more afterwards, because there are going to be working people that are impacted that are not going to be able to hang on to their housing, especially if we have a prolonged shutdown of the economy and people are not able to work. So I think I think we all recognize that there's a lot of give and take right now and a lot of flexibility from financial institutions and landlords, and there's been some protection with the halting eviction orders, and all of that is good. But at some point, things will get back to the way they were, or some semblance of the way they were. Landlords are not going to wait indefinitely for their rent. They're not going to halt evictions permanently. Back rent that's owed is going to have to be collected. So my point in all of this is just to say that I do think that there's an opportunity here collectively, not just we as service providers, but I think as policymakers, as electeds, to think about what are some other alternatives to housing, and to also educate the people that we're working with that, while you may want to hold out for that voucher and that apartment, the chances of that happening quickly they were very limited before, and they're going to be even more limited going forward. So what are some other options for you that make sense and that can work, in the post-COVID environment?
Well, and you mentioned, which I was already thinking about, with close to 4 million people now, unemployed, and yes, there's leniency, shall we say, at the moment with loans, with mortgages and rents and utilities and whatnot. There's a whole bunch of people out there who are one or maybe two paychecks, away from being on the street.
Right.
And so, which kind of leaves me with two questions, I guess. One, do you imagine, obviously no one can predict the future, but do you imagine a sort of a whole new crop of folks experiencing homelessness who may never have imagined they would? And, we talk about flattening the curve in terms of the virus here, but I sort of think that the curve in terms of need and people who we're going to be responding to who have been impacted by this is going to be a wave that's coming, months from now, when we really start to feel the impact of this, as you said, when things kind of get back to some semblance of normal, and the consequences we're left to sit with. So I guess the question is, do you imagine a new group of folks experiencing homelessness? And are you already seeing any of that? Are you already seeing any changes in the kinds of clients you're serving, or clients who, 8 weeks ago never thought they'd walk through the doors of the Access Center, and now they're there looking for food?
So yes to the first question. I think absolutely we're going to see more people experiencing homelessness. To your point, there are a lot of people, pre-COVID that were marginally housed. They were spending, in Los Angeles, we have greater numbers of people spending more than 30% of their income for housing. In many cases, people are spending 50, 70, 80% of their income for housing. So I do believe, sadly, that we are going to see more people falling into homelessness who are just not going to be able, to survive, especially long term, if they were already, financially on the edge. And I think that, that's a whole other, we could do a whole other, conversation about the lack of affordable housing and all the reasons for that, because it's not just COVID. We've been, digging this hole for decades. And I think what COVID has done is it just highlights, emphasizes the structural problems that we have within both our society, but I think within our housing system generally. To the second question, no, we have not seen yet a significant shift in terms of the people that are showing up for services. As I said, we have historically served pretty high acuity people. We are known for working, and I always share this anecdote. When I came to the agency in 1999, and I'd been there about a year, and I was having a meeting with one of my colleagues in a sister organization in town, and in Santa Monica. And the person said to me, "Oh, I'm so glad OPCC exists, because when we can't deal with somebody, we send them to you." And I thought, well, that's kind of a weird thing to say. There's kind of a backhanded compliment in there somewhere. But as I spent time at the agency, I kind of began to see, and I'm certainly not suggesting we're the only agency that deals with high acuity or challenging folks, but that has always been our hallmark, is we tend to work with people that other folks don't want to work with or can't work with. And so as a result of that, we have not seen an influx of people who are in a different category. Now, that doesn't mean that we won't. I think certainly I can, and this is anecdotal, but my Sunday shift at our interim housing, I'm fielding a lot of phone calls, and they're coming from people who would not normally be our clients. And we're getting plenty of folks who are on the streets calling, but we're getting other folks calling saying, I need access to food, I can't pay my rent, my utility bills, overdue, I've got a car payment, so it's coming. Absolutely, it's coming. There's no question. I imagine the Carter Center is going to see, if you haven't already, the numbers of folks increasing, just on the food insecurity side, I would imagine. But utility payments, rent, just the cost of living is going to be hard for people.
Well, I think to your point that this magnifies or uncovers perhaps some of the fundamental structural challenges we have, in just societally, in terms of certainly housing and economic, disparity. Just the whole highlights it. Doesn't create a new problem so much as it demonstrates the long existing problems that we haven't maybe wanted to address or neglect. This is just fascinating. I could sit here asking you questions all day, as you well know, but I want to give everybody else the opportunity, because I know that some other folks probably have some questions too. So you're welcome to raise your hand either virtually or digitally, or to put a question in the chat field if that's easier. What's on people's minds as we're privileged enough to have John with us for a few more minutes.
Fire away.
So, hi. I was wondering if you have found any holes in your delivery service that you might need that might lead in the future to a new service you add to your future.
Yeah, no, that's a really good question. I mean, I think in terms of gaps of services, I mean, this seems silly, but it actually, COVID has sort of lifted up this idea of people's ability to charge their cell phones. So we have actually been equipping our outreach teams with portable charging units, so that as they encounter people and that seems like a little thing, but actually for us, and I mean, the people we're serving, it's huge, but for us, in order to keep in touch with people, that's been really important. The other thing is we actually purchased many cell phones that more inexpensive, lower end phones, but just again to provide services, because all of our mental health services are telehealth, have been since we've been in the COVID response. And so we have found that actually, it's not, I would say, a long-term solution, and it's not as impactful as having one-on-one individual therapy in person, or certainly in a group, in a wellness setting, but it has been literally a lifeline for our clients receiving mental health services. So I think on a go-forward basis, we had been using telehealth slightly, but it made us more aware of how we could kind of refine those services and do a better job. So I think those are the two areas that I have seen in terms of service delivery that have been kind of gaps for us. The other thing I will say is that it has, again, lifted up this idea of trying to compress the amount of time that people are moving from the streets into housing. That's been something that we have been working on, as an organization for a very long time, but seeing how things have kind of come to a screeching halt just reinforces the importance of, if we want to have a system that is effective in terms of moving people from the streets into housing, we have to do that, faster. Not just we the people concerned, that's, my focus and something I have a little bit more control over, but throughout the system, I think we can do a much better job of that.
I know Merle has a question.
So you mentioned about the possibility of buying some of these hotels or motels for housing, for permanent or temporary housing, whatever.
Uh-huh.
Are these hotels or motels planning, have they gone out of business? Are they planning on going out of business, not reopening, or are they just there and empty buildings?
I'm not aware that any of them have gone out of business or are planning on going out of business. I think that there will be many owners that are not going to want to sell their properties. They're kind of riding this out. What we had essentially is you had a really large asset throughout Los Angeles County that was unused because no one's traveling, and the few hotel rooms that are rented I think there's something like a 95 or 98% vacancy rate across the county of Los Angeles. So I don't think that we can hang our hats on this as a long-term solution to suddenly say, okay, well, now all these hotels, motels are going to be converted. I think some of them will. I imagine that some of I can tell you that the quality of the hotels vary widely. They're not all, Fleabag or low end. Actually, the two that we're operating are very nice. They're in Koreatown. They've both been recently refurbished. They're kind of boutique hotels. One's a 46 room, and I think the other one's a 48 room. So these are not, they're not, the Four Seasons, obviously, but they're very nice. They're lovely. I would stay in either of them. So I don't think that this is about suddenly repurposing all of these assets long term. I think what will happen is there will be some shakeout. There will be some motel owners that maybe are strapped financially. The owners that we're working with are sole proprietors. They're not part of large chains. I think the large chains are more than likely not going to sell their assets. I think the smaller operators, it will be a mixed bag. I think it depends on, where they are financially. Again, how long this goes on. If it goes on, right now, these units are leased through the end of June. I think there's a reasonable hope and expectation that by then the stay-at-home orders will be lifted, that, we're starting to get back to a more active, economy. We'll see. This is all speculation at this point. So did that answer your question?
Yeah, and there was one other piece that on these facilities, are there people from your agency that are there helping the people that you've placed in there?
Yes. So
they're not just all alone is what I'm asking.
No, they are not left alone. No. These are staffed 24/7. And it's a combination of, so as I mentioned, this is a Project Room Key is an initiative between the county and LAHSA. So there's a hybrid kind of staffing pattern. And the beginning, when the hotels open, we have representatives from the fire department who actually, the first responder, and they're fantastic. I mean, they're really, really great, and lifeguards. So the county has their kind of advanced team who work with the providers on getting things set up and working on the intakes. And for about the first week, they're there on site to make sure that things kind of get settled in. Our staff are kind of the backbone. So 24/7, we have staff on site there. And then that's supplemented with what are called disaster service workers, DSWs, from the County of Los Angeles, which are essentially county employees who are not working in essential services and are being redeployed to help cover. And then we have a contracted security company. So I don't want to leave anyone the impression that this is a very robust service delivery. It's nothing like we do in our interim housing, because we can't. I mean, the resources, you can't bring to scale 15,000 rooms across the county, and we're not minting a whole new workforce. We're doing this, redeploying some of our employees, and are able to manage it. But no, we don't stick people in hotel rooms and leave them alone.
Okay, just curious. Thank you.
You're welcome.
I have a question, Rabbi.
Yeah, go ahead. I was just going to say, go ahead.
Oh, sorry, no. Sorry, I'm not used to working on Zoom. I didn't mean to interrupt. Should I speak?
Please, I was just going to say, I saw your question in the chat, and so maybe you can clarify it.
Oh, thanks. Yes, this is great. Nice to meet you, Mr. Maceri. I think about your organization a lot because I've tried to use the LAHSA app.
Uh-huh.
I have two questions. The first I make a little easier. Regarding the motels, there was a temporary shelter slated for La Cienega and Cascio. That's just a little bit south of Olympic. And the reason why I thought you might know about it is People Concern has the contract for the, I'm not exactly sure of how this works, for the LAHSA in my area. So Shari Lachlan is the person assigned from People Concern to handle the intake when we use the app to identify individuals on the street for outreach, correct? And
So
I thought you might know about that hotel that was.
I am not familiar with the one at La Cienega. I am not familiar with that motel. The two hotels that we're working on currently are both in Koreatown, actually not too far from the temple.
This was a CD5 temporary shelter, and Councilman Kret's office said probably 6 months ago that, there's no shelter, temporary shelter in CD5. And Councilman Rue's done a much better job of, finding properties. I was just wondering of the status of that.
Yeah, I have to say, Anne, I'm not familiar with that site. And we are not involved in a location there. So I'm not, and we can talk offline if you like, if you want to, I can see if I can get more information, but I'm not familiar.
It doesn't get dropped. I guess I'm just saying, I really hope that project doesn't get dropped because we don't have that temporary shelter. And secondly, on the HSA app, can you talk a little bit about the rate of success when we input an individual? I keep trying to help, especially women, when I see them by themselves on the street. And I haven't been able to get the social worker to make contact with that individual. It's so hard.
So I'm assuming you're talking about the LAHOP.org app for LAHSA for the outreach?
Yes, and then they connect with People Concerned.
Yes. So for those on the call who may not be familiar with what Anne's referring to, LAHSA developed an app. You can go onto your computer. It's a web-based referral, so that when you see somebody experiencing homelessness, you can make a service request for that individual. And there are street outreach teams that are covering the entire county. And so what happens is, as the requests come in, the outreach team assigned to that specific neighborhood will be given that referral, and then they will go out and try and make contact with that person. And it's free to use, and it's LAHOP.org for those of you that are not familiar with it. So if you have people near your homes or businesses that you are concerned about, you can make a a service request. I think what may be happening, and obviously we don't operate that, it's operated through the Los Angeles Homeless Services Authority, which is LAHSA. It's a Joint Powers Authority. LAHSA is the gatekeeper for those referrals. So what happens is that the referral comes in and then it is triaged out to the respective teams. I think what you may be experiencing, frankly, is that a lot of the teams in the areas have been diverted to work on Project Room Key and getting people identified and moved into the hotels. And honestly, there's a significant staffing capacity right now because all organizations, including LAHSA, have been impacted, by COVID, because so many of us, as I started, the call, one of the challenges is that we've all been impacted by having staff who would normally be able to work on site who can't for whatever reason. And so if you're feeling frustrated, I'm sorry about that, but that may be,
I'm not frustrated, but the people in my neighborhood are, and sometimes they call me and say, can you get rid of that tent, just because I'm kind of active. And I always point them to the app, and then I realize the priority now is with COVID, but honestly, I didn't have that much. Part of the problem before was that I think the social workers who come from people concerned, I think they work regular business hours, right?
No, our teams are staggered, and so if this is, and where is the person that you're talking about?
Oh, the person?
Yeah, the person that you're reporting.
Oh, well, often they're specifically around Wilshire Olympic and San Vicente. We get a lot of reports from there. It's near Wilshire, near the LA County Museum area.
Okay, so if we can talk offline, because I don't want to. I know we have a limited time. I'm happy to follow up.
Do you have contacts with other areas too, though?
I do.
Okay, thank you so much.
You're welcome.
Hey, Rabbi, it's Ross Miller. I just have a quick question because I know we're running short on time. Is People Concerned involved at all in the trailer program for the
trailer program? Are you talking about
all these FEMA trailers, and they're putting them in various community centers around the city? Is People Concerned connected with that at all? And if so, what can you tell us?
The only one, so I think what you may be talking about are so the city's response has been to convert several city rec centers across the city of Los Angeles into interim housing sites. And in many of those sites, they're using the inside, like gymnasium or whatever the community space is. And then outside, they are using trailers or campers or individual vehicles as kind of isolation areas. We are not involved in any of those, except the county has a facility at Dockweiler where there are individual recreational vehicles. There's about 112 of them. It was one of the first sites to come up. It's not connected to a city rec center. And at Dockweiler, we have provided some staff support there. It's primarily Department of Health Services that is staffing that because they are meant to be isolation units. But we have provided some staff support. That's the only one that we're involved in. But the city has providers throughout the city that are working in the rec centers.
Well, John, I'm conscious of the time, and I know how busy you are doing such meaningful and important, and I'll take rabbinic privilege to say sacred work. And so thank you for being so generous with your time and chatting with us this morning. I know I speak for everybody when I tell you how enjoyable it was and how special it was to be with you. And as promised, I most certainly owe you lunch when one can sit in a restaurant again, and very much look forward to it. So
thank you. It's really my pleasure. And thank you everybody for making the time. And thank you for all the work that you're doing individually and collectively at the Temple. And Bo, I look forward to breaking bread together.
Likewise. All right. Well, everyone have a wonderful day and hope to see you all next week.
Take care.
Thank you.